All right. Good morning. H. Robert Silverstein, MD, for the Preventive Medicine Center and West Hartford Cable Access TV. Today is Monday, April 7th, 2025. So today we're going to talk about the New England Journal of Medicine a little bit, some articles, not so much about the NEJM, but about some articles that are just fresh, hot off the presses. And we'll talk about a few other things. Uh, Before we get to the New England Journal, this is a gadget that you can get to, quote, exercise your lungs. And when it's got a steel ball in it, and you bounce that ball with your breath. So you take in a deep breath. And I don't know if you could hear the flutter, but that ball was bouncing around. And it's supposedly good for clearing out the mucus in your lungs. And I think it's a generally good idea. If you had asthma, I would do it. By the way, if you had asthma, I would be absolutely religious about 100%. That's what I mean by religious. No milk product of any kind. That includes crumbled cheese on your salad, the tiniest little bit of yogurt. And what I usually do is cream, ice cream, half and half, light and lively, 1%, 2% lactate, any etc. milk product. Now, one of the questions I always get is cow milk any different from goat milk? Is goat milk cheese safer and so on? If you have asthma, I strongly recommend that you avoid dairy products 100%. Uh, there's a person who largely taught me this kind of information. His name is William Spear. He and I are going to be presenting Department of Medicine grand rounds at St. Francis Hospital on May 1st. I don't know how easy it would be to log into that presentation. It will be online because I'm presenting it remotely. So I encourage you to check out and see if you would want to watch that. It will be 8 o'clock in the morning until 9 o'clock. William Spear will be speaking out. There will be an introduction. Then I'll give another little introduction. Then William Spear will talk for about 10 minutes. And then I will talk for the remainder of the time with the slideshow. William will also have a slideshow. He's one of the most brilliant people I've ever met in my entire life. He's had a profound effect on what I say and how I say it. It's just a literal privilege to know him and hear what he has to say. So I encourage you to attend that May 1st, 8 in the morning, Thursday, St. Francis Hospital, Department of Medicine grand rounds if you can. I've sent the link out to a number of people, and so far it's gotten very good reviews. And then you have to decide for yourself whether or not you think I'm an entertaining speaker or not. The name of the talk is A Little Preventive Medicine, Good Cop, Bad Cop. William will be the good cop, and as you might expect, I will be the bad cop. Which means dealing with things bluntly about disease prevention, like I just did with the 100% no milk product if you have asthma. By the way, if you have more coughing at night when you lay down, then that implies to me that you have some degree of acid reflux. And so you need to prop the head of your bed up, the head of your bed, not the whole bed. And what I recommend are called GI bed blocks. You can get those at medical supply stores or online. They're about 7 inches tall, and the feet at the head of the bed. Now, I know that sounds confusing. We're talking about those posts that come from the bed at the top, at the head, not the whole bed, not the bottom, but the feet at the head of the bed are elevated. And the purpose of that is the old principle of water runs downhill, not uphill. And so what we're doing is elevating you so that any liquid contents in your stomach don't run up your esophagus and then drop into your lung, angering your lungs and exacerbating asthma. So for the 10th time, absolutely no milk product of any kind, not a teaspoon, not a drop, not an occasional bite of ice cream, not pizza, 100%. By the way, I feel exactly the same for the prevention of breast cancer, recurrence of breast cancer, and the same goes for prostate cancer. Prevention of prostate cancer, prevention of recurrence of prostate cancer. Now, and any respiratory infection. All right, so let's get to the New England Journal of Medicine. Uh, Today's date was, I guess, this is the March 30th, 2025 uh, printing. The first was an article about oral Ozempic, semaglutide, it's called. I think the name of the product is Rybelsus. That's a cousin of Ozempic. And hi, Richard, doing my TV show right now, so I can't talk. Going on, that's another super brilliant person, Richard Daly. He has been so helpful to me in so many ways. He's in a league with William Spear, and I'm just amazed by the both of them not being in their league. I know. You think that's false humility. They have abilities, many abilities that I don't. I know I have some abilities, but they are truly impressive. William Spear and Richard D. Daly III. Now, going on, so Ozempic and Mounjaro are those injected once a week medications that basically shut down appetite so that you have what I call an active disinterest in eating. And as a result, people who overeat are less interested in overeating or even eating as much as usual. Uh, so the oral form, they are injections. Ozempic and Mounjaro are the injections. Now, oral Ozempic, called Rybelsus, was studied in patients with diabetes, and it was found out that it reduced major adverse cardiovascular events, heart attack and stroke, and basically were open heart surgery, angioplasty, stents, and so on. Now, the difference was 2%, and it was significantly different. But I'm and people are touting this as a very effective drug. First of all, I don't know what the cost of Rybelsus is, oral Ozempic, but to me, a 2% improvement doesn't seem like that much of an improvement. And it's one of the, maybe I just don't get it. But this is the kind of thing that makes me worry about publications in traditional medicine, that such a big deal is being made out of this format of Ozempic, Rybelsus, that it's so helpful. It is helpful, but it's barely helpful in my estimation. Now, going on, the next study was in the New England Journal of Medicine, March 30th, 2025, was about getting better blood pressure control in diabetics. Now, what diabetes does and what high blood pressure do is they're sort of like blowing on the fire that's inside the body when you want just warmth instead of fire. Uh, One of the studies that was presented in this was the Global Cardiovascular Risk Consortium study. And what it showed was that nutrition was the number one cause of major diseases, followed by cigarette smoking, and not far down the list was alcohol. So going back to the article that I'm talking about, the better blood pressure control, the fewer major adverse cardiovascular events there were. Now, what is a normal blood pressure? Well, um, it's not like I'm having trouble telling you. I'm having trouble because I sort of don't go along with the guidelines. And that becomes a problem. And what I thought about was a statement I made to the editor of the Journal of the American Medical Association, probably the second most important journal in the United States, that he liked. And I said, doctors guess at every step, and the best doctors have the best guessing rate. Another part of that email that I sent to him that he liked was, it's not a case of don't confuse me with the facts, but the best clinical insights exceed so-called knowledge by at least one step. In other words, there are people out there who have figured things out that are frankly better than what is being published. Now, how does that relate to the study about better blood pressure control? Well, it turns out that you got not all the way down, but the lower current blood pressure recommendations were better than slightly higher. And what is slightly higher? When I have high blood pressure patients, which is probably the second or third most common abnormality that I see in my practice, I generally treat if their blood pressure is above 125 for the top number, the systolic number, and or above 80 in the bottom number. So I don't like a blood pressure above 125 over 80. Now, what if the blood pressure is 110 over 90? Then the patient has to be treated. Or what if it's 140 over 70? Then the patient has to be treated, because I don't want either number above 125 for the top number and 80 for the bottom number. Now, that's what the study showed, that the lower blood pressure was better. And I said before, what is the natural human blood pressure? Well, I'm going to not exactly tell the truth, but for all practical purposes, the ideal blood pressure is 110 to 115 over 60 to 70. Now, if you have high blood pressure, you may not tolerate a blood pressure that low. But if you don't have high blood pressure, then that is probably where your blood pressure should be. It turns out that newborn children have blood pressures like 90 over 60, and even some patients will tolerate that. Occasionally, I have a patient who's being treated for hypertension, and they'll come in the office and feeling fine, and their blood pressure is 90 over 60. That makes me a little bit nervous, and so I do try to ease up on the treatment. For most values in medicine, there is a U-shaped curve, too low, too high, and just right, what we call the Goldilocks area. So you don't want it too low, you don't want it too high, and you want it just right, like Goldilocks. So I think I'm saying so often today. So I want the blood pressure in the walking well to be 110 to 115 over 60 to 70. And I want a blood sugar to be 83 at 2 hours after a sugar challenge in people who are not diabetic. And I want it to be 155 or less in people who are not diabetic. And that's how to prevent MACE, major adverse cardiovascular event, which includes heart attack, stroke, angioplasty, stents, open heart surgery, and so on. The next study was about Mounjaro, tirzepatide. What they found out was overweight people who were put on Mounjaro had a reduced incidence of diabetes. That gets a duh, no kidding. When you reduce people's weight, there is a much lower incidence of diabetes, and that's what tirzepatide does. So no surprise there. And that was a publication, in a certain sense, as if we didn't know it. Now, I don't know what the cost of that study was, and that's one of the things that I would hope that RFK Jr. would look into, simplifying the criteria for bringing medicines on the market. I know we've had some problems in the past. There was that famous case where one medication was very effective for helping people sleep, and it caused the disastrous syndrome of loss of arms so that literally the hands came out of the shoulders. Um, and there have been other medications which came onto the market that had major adverse cardiovascular, major adverse events. Now, everything needs to be in balance. There can be too much or too little of anything. And I think the current requirements for studies vastly increase the cost of these studies, which vastly increase the cost of the medicines. And speaking of that, cost of medicines, I can't believe that we allow, who is we? Well, you'll have to decide that for yourself, that we allow medications to be sold in the United States at completely different prices than they are available in England or France or anywhere else. And just FYI, a vast number of our medications come from India, are manufactured in India. I do think that 47, Trump is correct about getting manufacturing back in the United States. Uh, for multiple things. We are too dependent on international everything. And it's not that we shouldn't be globally involved, but on the other hand, we ought to have the ability to make our own drugs, to make our own steel, to make our own automobiles without necessarily being dependent upon the slings and arrows of outrageous fortune, meaning whether or not countries like China want to cut off our rare earth imports, which they just did. China either put a big tariff on them or simply cut off shipping them to the United States. Well, the United States has had the ability to find these rare earth minerals. As a matter of fact, lithium, one of the major ones, has been known. But to be perfectly honest, the Biden administration would not allow the mining. I didn't say the mining was going to be easy. I didn't say that it wasn't going to have side effects on the environment, but we ought to be able to mine our own lithium if we have it and figure out ways to mollify, to make more benign the effects of such mining. Now, going on was an article about the prevention of AIDS, HIV. And there is now an injection that can be given twice a year, lenacapavir. I don't know what the trade name is, but certainly that's a little complex, lenacapavir. Given that, I think it's given once and then it's given again in 3 months and then it's given every 6 months, or maybe it's just given every 6 months. But that prevents acquiring HIV when exposed. In addition, it turns out that you can prevent apparently gonorrhea and syphilis and chlamydia by taking doxycycline before unprotected intercourse from someone who is infected with those conditions. So those are two preventive ideas for how to reduce the incidence of HIV as well as standard venereal diseases. Now let's see here. Oh, then there was I already mentioned it once, the global cardiovascular risk study that showed that diet, nutrition was the #1 cause of most diseases in the United States. As you know, 3/4 of Americans are either overweight or obese, and I'm not immune to that myself. As you get older, you have to exercise more. It's not like diet isn't important. It turns out that food choice is 70% of weight loss and exercise is 30%, but you can't lose weight down to what is the goal of weight loss? The goal of weight loss is not a number, although there are numbers that correlate in general, and that's a BMI of 22 to 25. But the real goal is to look down at your tummy and see if you can see where the muscles meet the muscles. It's called abdominal clear lines of definition and demarcation. That is the goal, like the standard blood pressure goal is 110 to 115 over 60 to 70 in people without hypertension. My goodness, that was quick. Apparently, we're almost done. So if you have any questions, you can contact me at the office. The Preventive Medicine Center has a website where questions can be sent. I don't respond in detail to medical questions in the sense that, oh, I have high blood pressure and what should I be taking? No, that's not something that we're going to respond to. So go to the Preventive Medicine Center. The website is www, obviously, and then it's the PMC, PMC, and it is a 501c3, so send millions fast to West Hartford Cable Access TV and the Preventive Medicine Center, www.thepmc.org, thepmc.org. All right. I think that's pretty much it. A good day and God bless you all. It's kind of a rainy, cloudy day today, but still spring is here. I guess that's what spring is about. It's not exactly summer yet. There's winter spring and then there's summer spring. And right now we're in transition between the two. Some days are still cold and unpleasant. Some days are nice and comfortable in the 60s. So see you next month or next week, however you want, and enjoy the show. Thank you, H. Robert Silverstein, MD.